Okay, so hello everyone. Welcome to this webinar on the stories of gender-affirming care, the experience of trans and gender diverse youth and children. So this is a webinar where we're going to talk about research that we are just wrapping. And so to do so, we are going to be two people who have worked on the project. I am Annie Paulin-Sanfasson. I was the principal investigator on that project. I'm at the University of Montreal, and I am accompanied by Frank.
So my name is Frank Zurich-Kielik, and I'm the research coordinator for the Stories of Gender-Affirming Care project.
Perfect. So do you want to change?
Yeah, I'm going to change the slide.
So this is the whole team. This is a project that was funded by the CIHR from 2016. And it's a project, as you can see, that is not just in Montreal, but also in other clinics. And this is all the people who participated in the project so far. And so what we're going to talk about today is the overview of the project, what we've learned from the youth about their experience, and we're going to look particularly at how their gender identity developed and evolved, and also their experience of seeking and receiving gender-affirming care. And so we want to share our finding with you, talk about the next step, and answer some questions if you have any. So the project, the aim of the project was to explore the experience of trans children and youth and their family accessing gender-affirming care before and during after puberty. Because what we have is that we have got very little information about youth who specifically access care. So we get like more and more studies that will look at youth, you know, in every different spheres of their life, but we had like really gap in terms of knowledge. So we wanted to know more specifically why they seek care and how they accessed it. What was the strategies they used to express or address dysphoria and navigate social and family situation, what contribute to their well-being and quality of life, and their experience, their overall experience of affirming care and medical interventions for those who had started. So this is what we're going to look today. So the project was developed in parallel with a quantitative sister project that is led by principal investigator Greta Bauer and Margaret Larson, who are both in Ontario, which is called the Trans Youth Can. And this project has been developed in consultation with community member and service provider. Youth and their parents were recruited at 3 Canadian specialty clinics that provided gender-affirming care to trans and gender diverse youth and their or children. And so what's interesting about that study, so that we wanted to have a look at not only what the youth were experiencing, but also how the parents see things, not to compare and contrast, not to find incoherence in discourse, but just to complete and have a much broader understanding of the reality of those children. And so we recruited parents and their caregiver. So it was not just children and their caregiver, sorry. And so we recruited them at 3 different clinics. You're a little bit far. Here we go, thank you. At the Meraki Center in Montreal, at the Children's Hospital in Eastern Ontario, and at Good Day Clinic in Winnipeg. So we interviewed 36 pair of child parents. So we wanted to have 12 per clinics. And what we tried to do is to really try to get like a broad range of diversity in the sample. So we wanted to have some prepubertal trans children and youth, and we wanted to have some who had started puberty. And we interviewed also their parents, and they also completed a socio-demographic questionnaire. So then we could know, you know, who they were a little bit more. And then we looked at all those data. That was a lot of interview, because it's in fact 72 interviews that we gather, and we did some thematic analysis to try to explore and understand what were the themes coming out of their narrative. So this is who participated in the study. So we had 36 children and youth. They were between 9 and 17 years old. We had 15 trans feminine youth and 21 trans masculine youth. We put them like that. There were different ways of talking about their identities. So we were going in the interview with the way that they wanted to kind of talk about themselves, but for the presentation, we just split them into a very binary way. Although, as we're going to see a little bit later, 3 of those those youth were not identifying fully like on the binary spectrum. So in digging into their experience, we realized that they were more like on the non-binary spectrum. We had 7 interviews in French, 29 in English. We work in both languages because the team had a bilingual research assistant. And we had 15 youth who had changed their legal gender marker. 3 were in the process. And you can see on the right side the distribution of the age. So we had a good age range with a few pre-pubert child. And what's interesting is that the 9 to 11 did not start puberty. The 12 and above had started puberty, but it just happened like that. We didn't, you know, we just want to stress that actually you can have youth of 11 starting puberty and youth of 13 who didn't start puberty. But for our sample, it just happened like that. The majority of the youth were white, but we had 3 youth were Asian descent and 3 were indigenous. All Asian and 1 indigenous youth were with adoptive or foster parents. 30 of them were covered by private health insurance. That's an important information because it might affect access to care later in terms of medication. And they are sold income tended towards higher value compared to the provincial census data. So one of the first questions, and there's a lot of questions we're asking ourselves in that project, but one of the questions that we wanted to understand better is how they express and address gender dysphoria and how gender identity is shaping across the experience of care. So, so we analyzed the data. We had a few questions about that during the interview. And so we also wanted to know what process influence how their gender identity develop and evolve. So I'm going to start talking about how that gender identity develop in terms of like categories of gender identity development, and then Frank is going to explain what's the process. And I'm just going to say that we've organized those trajectories of gender identity development in 3 distinct categories, but in fact, you know, there's some youth who are not so clearly fitting in one or the other. But I think it's really interesting to look at that, because it allows us to see that actually in literature about gender identity development of trans youth, we see that author in the past thought that they were just like early onset gender dysphoria, so those who were experiencing gender dysphoria early, and those who were late onset, so those who were experiencing gender dysphoria later in life. But what we see is that we've got much more categories than that in those kids who are accessing clinics. So this is an interesting finding. And it's also, there's a sister study that was done in Switzerland at the same time. There's also one in Australia and one currently happening in England, but the Switzerland study looked at 2 trajectories of gender identity development just a little bit before we started looking at the Canadian data, and they found those trajectories. So we built from their understanding and we looked into our information in our data to see if it happened, and basically things become even clearer. So I'll present you the 3 developmental trajectories or pathways. So we've got the trajectory A, which is you know, young people who had felt an early dissonance, but were also affirmed by their parents or caregiver early, and they transitioned, they were able to transition also to their affirmed gender early. Then we've got trajectory B, that is an early dissonance, but for some reason that we're going to explore in a minute, they had to delay their transition, and often parents were not really aware of that. So that's an interesting category. And then we've got like the trajectory C, which is a late appearance of gender dysphoria. So if we look at the gender development trajectory A, so these are youth who question their assigned gender at a young age and were firm in exploring and asserting their felt gender identity at an early age. So here you've got Elisa, who is 10 years old. She explained that when she realized that she was still a baby, so for her, the memories of, you know, gender identity that is different from the sex assigned at birth is very young. She says, I used to tell my mom, when I'm going to be a girl, can I have that? when I'm going to be a girl, can I have that? So she was repeating, pointing at things. And when she asked me question, do you think you're going to be girl when you're going to be older? And I said yes. So you can see in Elisa's trajectories, for her, it was very clear from very early on. So we had a few young people, about 6, if I don't make a mistake. Frank, correct me?
I think I don't remember the exact number, but I could
But a small
check
number
that.
of those young people. And actually, it was not the majority of those young people that we saw in our sample. But you must understand that we choose a diversity of young people. So it's not because we didn't have a lot of trajectory A in our sample, it's because there's not a lot of trajectory A in the Phoenix. Okay, just what we saw in our sample. Then we've got the trajectory B. So these are young people who questioned their assigned gender, or they felt a discomfort in relation to it at a young age, but did not assert or explore it until later. The reason that they explained, either they were finding resistance from parents, they were having fear of being bullied, but in that trajectory, what is very clear is that those young people knew that there was some sort of incongruence from early on, and they had lived the burden for a long time before being able to explain it to someone. And so here we've got Anika, who is a 15-year-old girl, who explained that before I transitioned, I was like one of the few that like got bullied. So Anika here was bullied at school, and she was like, I can't add something more to that. So I wanted to wait to transition until I got to high school. And then I tried to hide my transition from everyone, like my aunt, my uncle, my grandparents, even like my siblings in a way, because I felt weird and like uncomfortable. But then like as time went on, like at the end of grade 6, I started to like not give a damn. So basically we can see from that trajectory that Anika has been reflecting and has been feeling something for a long time, but it took a very, very long time before she was able to affirm it to people around her. So this would not fit into what we would call a late onset because it's a long time that she had gender dysphoria. She just didn't have the space to explain what she was experiencing in comparison to our trajectory A, who were feeling it for a long time and they were able to express it fairly quickly to people around them and transition early.
Oops.
And then we've got the trajectory C, and these are youth who only began to feel a discomfort regarding their assigned gender identity at or after the onset of puberty. So those young people, when we look at script, at narrative, at their interview, what we see is that they didn't experience any incongruence when they were young. Those young people were navigating gender role and gender norms and, you know, were absolutely fine. And it's really when puberty hit that they started feeling a very kind of strong urge to do something about it. And here you've got Jessica, 16 years old female, who explained, and these are the way that they describe themselves, by the way, did not really think much of my gender identity growing up. I guess I was pretty just male till like grade 8, roughly 13 years old. And then there were lots of signs, I guess, up to that point.
So as Annie explained, we kind of tried to categorize the youth according to their trajectories, but all of their stories, sometimes regardless of their trajectory, included many different processes through which they explored and developed their current sense of gender identity. And we can kind of divide these in terms of personal processes, so things that were really internal, and then social processes that were really in interaction with the outside world. And there was actually a lot of overlap between personal and social processes. And for many of the youth, their trajectories were intermittent or roundabout, and sometimes they advanced, paused, or even retreated in their process of development. So one of the most obvious examples of these personal processes included the body or gender dysphoria. And this was often a guide that helped them or pushed them to explore their gender identity. So we have Jeff, who described himself as a boy, who said, I started to realize I really didn't like how my body was changing when I started puberty, so around 9 years old. When I was 9, I realized, no, I really don't want to have breasts and stuff like that. So that was a clear expression of body dysphoria. And there was other youth, such as Brandon, who talked about feeling dysphoric a lot of days. I've always had trouble with my body, even more so now that I've accepted my gender identity and really feel like my body doesn't match how I feel. There were a lot of examples of processes that were both personal and social. And again, sometimes the discomfort that youth experienced was a driver for their exploration or actions related to their gender and transition. So one youth, Sylvie, who described herself as a girl, she said, she described how there was a period where she revoked her transition for several months. And then she said, it just came back as a feeling. And then I was like, no, I don't want to stay how I was born. And then it just came back stronger than ever. And then my transition finally started. And then Tia who described herself as a trans girl, described how the effect of name calling and shaming was really unpleasant, but also helped her to question how she was feeling. So the fact that people were calling me gay, that I wasn't recognized as what I was, that people didn't understand and that I didn't understand either, that's what made me so angry. I fell into a kind of depression, and then towards the end of grade 6, it triggered, I couldn't take it anymore. And after that, in the summer, I was looking for an explanation for how I felt, and I came across the term transgender. This is a good segue to another important process that was both personal and social, and that was making meaning of the feelings that youth had. And so accessing information or concepts about trans identity through media or through contact with a trans person often advanced their process of gender identity development. So Sylvie, a 13-year-old girl, said, it just took some time for me to figure out the right word. I was looking through YouTube and I found some videos and I watched it, and I just connected with it. Adrian described a similar experience of hearing about a trans person and then saying, but then I tried getting closer to that person and I realized that we had a lot of stuff in common. And that's when I really started thinking about it. Other examples of social processes, including exploring and experimenting with their gender with feedback from others. And this included experimenting with language, labels, and pronouns. And Jim described, who described himself as a trans guy and who interviewed in French, described the using the gendered nature of French as part of his process of exploration. So I started to gender myself male when talking about myself in French. First, I stopped using the adjectives that you have to change to show it's male or female. I always tried to avoid, and if I really had to, I used the male version of the word. But it was just a word every few minutes, but people didn't really notice. But at some point, it became all the time gendered male. And then there were a lot of examples that youth shared about how they experimented with different modes of presentation, including their hairstyle, their clothes, binders, makeup, etc. There were a few youth who said that there was a period where they first were questioning and exploring their gender and really questioning whether their identity corresponded with their assigned gender identity. And then there came a point where they stopped expressing that and tried really hard to present themselves in a way that was in line with this assigned gender for a while. And that actually generated a lot of discomfort for them that may in fact have helped to clarify their authentic gender. So Stephanie said, then I got like introduced to like the idea of transgender, and my parents started letting me wear these kind of stereotypically feminine things. And in grade like 5, I started making sure that I was very masculine and stuff. But then I'm like, I wasn't comfortable. So then I kind of like just embraced it, my feminine identity. So we see this kind of trying out a different identity, and then for a while, in a few of the narratives, they actually spent a period of really going back to trying to be very feminine or masculine or in line with their assigned gender. There were other youth, actually quite a few, who first explored sexual minority identities, so lesbian, gay, bisexual, or various queer identities, before finding out about trans identities or considering that they might be trans. So Eloise, who described herself as a trans woman, said, it's really around the age of 16 that I started to feel unwell because I did many coming outs. First, I came out as bisexual, then as homosexual, and now transgender, but that's it. Personally, I thought at the beginning that I was homosexual, but after coming out, I didn't feel better with my life. I thought it would fix things, but in fact, there was still something wrong and I didn't know what it was. So other examples of interacting personal and social processes included the important role that trans-positive and affirming spaces played. So they gave youth the opportunity to explore and express their gender. The really important aspect of support from family, friends, mentors, and role models. And then they also talked about kind of some very specific contexts and situations such as resistance, ignorance, or pointed questions from others in relation to their gender identity, experience of partial or conditional support, and situations where parents who were struggling with other life challenges seem to really impact their well-being and maybe also influence the process of gender exploration and development. There were also quite a few youth who felt that their experience of identity didn't fit with what they heard others say was the appropriate or real experience of a trans person. So here we have Scott, who described himself as male or non-binary or agender, who said, whereas a lot of mean comments online where people are always saying that stuff in the middle, meaning in the middle gender-wise, between the binaries isn't real. And I've even heard people, doctors themselves, say that they don't really believe in other genders. So I just kind of thought, it got to the point where I convinced myself, you're right, it doesn't exist. There's no other gender. There's only male and female. So I chose male because I feel I fit more with male. And as we mentioned earlier, there were quite a few youth stories of how they kind of moved forward in their gender exploration and then sometimes stopped or retreated, as we talked about the earlier young girl who talked about revoking her transition. Joey, who's describes himself as a 13-year-old transgender male, described going to the specialty clinic when he was very young, around 6 years old, because I was feeling certain feelings and then it got overwhelming and I stopped for a while. And then finally it was like a full year where I just didn't even bring it up once. And then after that, it was like, I can't take it. I'm done. This transition has got to happen. I always knew I was trans. It was never a no. I know my mom tells me all the time that she thought I was going to be a tomboy or something, but I always knew. It just got to a point where I just wanted to stop talking about it. That's it. But I never changed my mind or anything. So these were, after we asked the youth about their experiences of gender exploration and development, we also asked them quite a few questions about their experiences of accessing gender-affirming care. And for many of these youth, accessing gender-affirming medical interventions played a crucial role in their exploration and consolidation of their gender identity. And so some of the themes that we'll cover in the presentation that came up were the path that led them to accessing and receiving gender-affirming care, which was often rather long and kind of convoluted. We heard a lot about what interventions they sought and what their expectations were and how they felt about the results of these interventions. And then they talked to us about their assessment of care that they received at the clinic. For more details, you can read a paper that was published last year in the International Journal of Transgenderism, and we'll share that link after the presentation. So we asked youth why they sought gender-affirming care, and their answers mainly centered around their need to get assistance in addressing their gender dysphoria. And many of these youth talked about how they had thought about suicide in the past. So there was a lot of distress associated with their gender dysphoria. And actually, we were somewhat surprised that in a large number of cases, majority, the idea of first seeking gender-affirming care was first raised by a parent or a professional after the youth raised these concerns about and discomfort about their gender identity or expression. So Adrian said, to be honest, I forgot how I started at the specialty clinic, but I remember my mom and I talking about next steps. At this point, I was still very unsure. And so my mom had the idea that I could talk to someone. I talked to many different people who had more knowledge than me, maybe so they could help me, guide me in the track that I'm trying to get. And so she found the place here. And so I came here and I met with the clinic intake nurse, and that was awesome. So a few of the youth did actually say that they specifically came to their mother and said, I want to go to a clinic, or I want this specific medical intervention. So that was the case of Randy here. And all of the youth actually had to wait several months and sometimes years from the moment they first told a parent about their gender identity until their first appointment at the clinic. So this helps us to understand that how often they had quite a sense of urgency once they got to the clinic, and at the very least, mostly had a very clear idea of what interventions they wanted. So a lot of these youth described the point where they came out to their parents as not the first step, but actually a hurdle that they had to overcome before they accessed care, but they also had to do a lot of personal work to get ready and to feel confident and positive about their gender identity before they actually talked to their parents. And Eloise described how, of course, if I talked to my mom before my puberty hit, or when I was like, sorry, I lost my thought, was 10 years old, yeah, I would have done it. Yeah, I would have told her. Everything would have happened. I would have had my real puberty as a girl. It would have been easier. But I don't regret my life right now. I'm really happy with my life. But if I could have told her sooner, I would have done it. So we asked the youth what interventions that they were seeking, and the youth who were under 12, who were all happened to be pubertal, had not yet undergone any medical interventions. And most of them had specific ideas of what effects they wanted, but they had a somewhat vague idea of what interventions would help them to achieve these effects. We noticed that there were 2 youth had a very marked fear of needles, which seemed like it could have actually posed an obstacle to them taking blockers. So this is just an example that I'll skip over of a discussion the interviewer had about needles, which came up as a really clear fear. The youth who were 12 and over, which were the majority, we had 32 youth, all had a much clearer idea of what medical interventions they wanted. And many of them, when we asked them about blockers, said that they really just hoped the blockers would stop puberty. And a few female assigned youth were talking about the desire to stop menstruation. Oliver, who described himself as FTM, said, I was really scared. I was like, we have to get there to the clinic as soon as we can to stop this puberty, just like a complete stop of everything. Because like I said, I'm not uncomfortable with my body, but I'm more uncomfortable how other people see my body. So I didn't want it to fully develop. There were the desires that youth described from hormone therapy were pretty somewhat different depending if they were assigned female. So we kind of categorize them largely as transmasculine youth. So these youth wanted to change their voice, their face, or their body shape, or grow facial hair, whereas the transfeminine youth talked more about changing their body shape and developing curves. And so Juliette talked very emphatically about how eager she was to develop breasts. In terms of surgery, transmasculine youth, so female assigned at birth, were more likely to want top surgery, whereas trans feminine youth were more likely to want bottom surgery. In terms of positive outcomes, they shared a lot of ways in which accessing these medical interventions made them feel happier. So Jeff, who described himself as a boy, said, "I realized that I accepted myself much more and that it felt much less bad looking at myself in a mirror after taking blockers." Whereas Joseph said, "Since I was 7, I would hit my arm against walls and stuff because I was just really unhappy. And it's better now that I'm on testosterone because I'm feeling kind of content, like things are going to get better." So it hasn't been bad for quite a while. And a few youth said that just knowing they were going to begin gender-affirming care or medication made them feel better or less anxious. And that was the case of Eloise, who said that just having the prescription to start hormones, knowing I'll be starting soon, already makes me happier because it's a big step in my life that's going to bring me towards physical changes, and it's going to bring me towards being who I really want to be. So I'm going to pass it back to Annie now.
Yeah, so I'm going to talk a little bit about their experience in gender-affirming clinics, because that's another side of their experience we wanted to understand. So just to remind people that we collected data in 3 clinics, one in Meraki in Montreal, CHIO, Children's Hospital of Eastern Ontario, and Good Day in Winnipeg. So participants said all staff in the clinic always use the correct pronouns, so that was good. Many said that staff were helpful in getting them access to medical intervention, helping them understand their gender, so it was like a positive experience, and they felt heard, welcome, and validated, cared for. So that's like really what emerged from the narrative overall. And you can see here a citation from Jake, who said that it was helpful because someone knew a lot about that stuff, more than Google. So it was very helpful for Jake to understand what was going on and help him make a good decision. There was also frustrations. So some youth explained that there were too long waiting time because the clinic waiting list or treatment protocol. We had some youth, for example, who wished to access a particular intervention but could not. They were told that they could not because they didn't fit the protocol. We had youth who had to wait several months, and that was too long considering the urgency of their need. There was also discomfort about some questions asked by staff. There were questions that they felt were not necessary. Youth sometimes felt that they had to convince staff that they were trans, and some staff had limited understanding of non-binary youth. So we need to expand the care option available to them, obviously, and we had some example here. There were also concern and reservation about care. So obviously when you take gender-affirming care, there are side effects, but most of them are wanted side effects. For trans masculine youth, having, facial hair would be a positive side effect, but there's also unwanted side effect that came with some of the medication. So this is not what every youth have said. This is just kind of an example of some side effect that came out. We had some youth talking about pain at injection site. Some said that they had hot flashes, issue with mood, increased acne, weight gain from blocker or hormone. And some youth described more serious side effects. They link themselves to blockers. So this is what they think was. So we had the youth who talked about vomiting due to a hot flash, strong fever after the injection, and a suicide attempt. I'm going to talk about it in a second, and some stress fracture. So in terms of, do we have a slide about that?
Yeah.
Frank? Yeah. So, so we had one youth who talked about, who linked possible use of Lupron and suicide together, but the youth was saying that it was a very, very difficult part of their experience, insofar that they were also rejected by friends. They had no or little support around them, and it was a very, very dark moment. So they started to take the blocker, it all accumulated. But what's interesting is that we also asked them about whether they had second thought or regrets, and none of them said that they had some. So even youth who had the most serious side effect felt that these medical transitions were the right choice for them. Even they had questions. So this is really good also that we see young people questioning whether it's the right thing to do. Because sometimes in the narrative, in the media, we hear, oh yeah, those young people just do these things without, you know, really thinking or understanding what the consequences. And this is not what we see from the narrative. So here is the citation from Jason, is the one who did a suicide attempt and linked it to taking a blocker. Said at the time of my suicide attempt was one of my most stronger part, where I was like, okay, what if I'm a lesbian, you know? So there were lots of questioning, but that eventually everything stabilized, and I was like, but I'm so much up here, come on. I wouldn't make sense. But honestly, I personally don't think it will happen to change my mind. In a hypothetical case, I would definitely say something if I would be repeatedly thinking about it, if someone would be actively making me miserable stuff. So you can see that the person is thinking, okay, is that the right thing for me? Yes, it is. And even if it is not in the future, I'm still going to be able to decide otherwise. So it's really, really kind of good to see that. So a majority of youth had never questioned their decision, and those who said that they had passed out said that they were just fleeting, like Brandon here, who said that they had little moments where they were like, what am I doing? This is something serious. But then when I look in the mirror and I listen to my deeper voice, I'm like, this is what I want to do. So in terms of gender-affirming care, we would say that almost all the youth describe their experience of accessing medical intervention and gender-affirming care at the clinic in positive terms. Many youth also describe improved well-being since they came out and started accessing gender-affirming care, and frustration most frequently evoked by youth concern delays in accessing gender care and intervention. There are several youth described having unpleasant side effects, but none said that they regretted any of the gender-affirming medical intervention they had received. So these results are similar to what few studies have already said, but there are one major difference. All youth said that the specialty clinic staff ask for and use their preferred name and pronoun. And one of the difference here is probably that we did the research in gender-affirming specialty clinics. So these are clinics that just look after trans youth and give, you know, gender-affirming care. Whereas the other study that we consulted before doing the research were places where you could get gender-affirming care, but they were not specialty clinic. So that explains probably, you know, why in our study everyone said that they used the preferred name and pronoun, but some youth in our study said that when they went to other department of the hospital, for example, that they were also misgendered. So I think that shows the importance of having like very clear gender affirming protocols in clinic that work with trans youth and kids. There are some limitations of the study. We need to tell you about that. You know, youth story about their medical and social transition are often intertwined, so it's sometimes hard to separate how each affected their well-being. You know, earlier when I say that on youth link side effect to Lupron, well, this is in their perspective. So, you know, it doesn't mean, you know, maybe one person had a side effect that was not linked to that, even if they think it is. So we can't kind of delimitate those. It would have been interesting to have a more diverse group as well, because as I said, you know, that sample was mainly all white. The study design and recruitment approach meant that only youth whose parents were fairly supportive of their gender identity participated, because the parents needed to participate. And we actually invite you to come to the next webinar, who's going to be on the parents' experience. And the sample of prepubescent youth is small, so we just got like a few youth who did not start yet, you know, any medication. So we've been kind of sharing those study results so far in different conferences. We've also published in scientific journal to reach provider and researcher. We've published so far 2, and we've got one that is submitted. We also got the good habit of trying to publish fact sheet summarizing the findings, because scientific journals are not always accessible to everyone. You can find those fact sheet on the website Jeune Trans Youth. At the bottom you can see the address, and we are doing 4 webinars with youth and parents for you about youth parents experiences. We continue to work on the data. We've got like an immense amount of data to continue to look at. I would say that one of the most pressing issue, and we will probably demonstrate that in the near future, is to finalize the data analysis that establish the dialogue between what the youth said and what the parents have said. We're still working on that, because so far what we've done is to analyze the data separately, youth and parents. So now we are putting the data together, and we're trying to identify if there are incoherence between what the parents believe to have seen and what the youth have experienced. We also want to have a look at what action and gesture are experienced as more or less helpful by youth, and we want to have a look at the predictive risk factor and resilience. So the upcoming work, we've got like more article in progress. We've got some master student, one on the experience of prepubertal children, and there's another one on social support that is not written here. And we are going to do more research. We've had a community consultation last April, and people who participated really kind of supported more research in terms of understanding better the process through which children and youth explore, understand, and learn their identity, but also how that interacts with like other people around them, including families and siblings. So we are going to continue proposing research through funding bodies, and we are currently working on an international comparison. I mentioned earlier that we've got already sister project in Australia, in Switzerland, and in England. Now we're working in trying to build an international comparison study where we can really track the experience of youth as they try to access gender-affirming care, because not everywhere they can access it. Like in Canada, that is considered, I think, fairly kind of well-developed as service. So we invite you to visit the site jeunetransyouth.ca for more update on the project, this project, and any other project that we're working on. So we want to acknowledge the funding from the Canadian Institute of Health Research, and also thank you to current and past members of the team and others who helped develop and realize the project, including community members and advocates, trans and gender diverse adult and youth, family caregiver, clinician, and other service provider who work with them, and especially the participant of the study.